We continue with the 5 transporting points. SI1, the Jingwell points, lesser marsh. SI1 location on the little finger, point 1 tune from the ulnar corner of the nail. How to find? This point is located at the junction of 2 tangents drawn along the lateral and proximal border of the nail, approximately 0.1 tune from the actual corner of the nail. Heart 9 is located at the radial corner of the nail. Needling 0.1 to 0.2 tune vertical or obliquely in a proximal direction or prick to bleed with a needle, lancet or 3-edged needle. Caution is painful point. For the actions and indication, SI1 expels wind and heat. It opens the orifices, revives consciousness, opens the channel, benefits the breast. For the special features, SI1 is a jingle point, metal point, and 3 point. Like most of the well points, SI1 is used for excess pattern to eliminate pathogenic factors. SI1 expels wind heat in the exterior attacks, especially when the symptoms affect the head and neck, causing stiff neck and headache. It is also good to treat acute tonsillitis from inhalation of exterior wind heat. It also extinguishes internal wind and promotes resuscitation in cases of internal wind and phlegm, blocking the orifices and causing sudden unconsciousness as in wind stroke. Apart from its role in exterior patterns, it can also be used as a distal point for channel problems of the neck, such as chronic stiff neck or acute torticollis. Finally, it is an empirical point to promote lactation after childbirth, mostly in excess patterns. That is, when lactation is inhibited by the presence of some pathogenic factors or stagnation, such as stagnant liver qi. For the summary, it expels wind heat, aversion to cold, fever, febrile disease. It also extinguishes wind and promotes resuscitation, loss of consciousness from wind stroke. It removes obstruction from the channel, cold sensation below the heart, feeling of oppression and pain of the chest, pain in the ribs, stiff neck, pain in the back of the shoulder, pain in the arm and elbow. Clears heat, those with red eyes, nosebleed, thirst, mouth ulcers. It also subdues rebellious qi, those having headache, dizziness, deafness, tinnitus, stiff tongue. It also promotes lactation, those having agalaxia. SI1 is the Jingwell point of the small intestine channel. In common with all the Jingwell points of the yang channel, it has a strong action on clearing the heat from the opposite end of the channel in the head. Branches of the small intestine channel ascends to the ear, the inner and outer canthus, and alongside the nose, while its paired heart channel opens into the tongue. SI1 therefore has a strong effect on the clearing heat or pathologically ascending yang from the eyes, ears, nose, and tongue, as well as the mouth and throat, and is indicated for such excess disorder as red eyes, tinnitus and deafness, erosion and ulceration of the tongue, painful obstruction of the throat, mouth ulcers, drooling, and nosebleed. According to the classic of difficulties, the Jingwell points are indicated for fullness below the heart, while the region below the heart specifically refers to the upper epigastrium. Like many of the Jingwell points, SI1 treats fullness in the chest region as a whole and is indicated for oppression and pain of the chest and heart, cold sensation below the heart, and pain of the lateral costal region. In clinical practice, however, SI1 is principally used for swelling and abscess of the breast and disorders of lactation. Absence of lactation is primarily differentiated into 2 types: insufficiency of qi and blood resulting in inadequate production of milk, or stagnation of liver qi, which leads to obstruction and coagulation of milk in the breast. Small intestine primary channel descends to the center of the chest at REN17, and these 2 points are frequently combined to treat insufficiency or total absence of lactation. Breast abscess is usually due to liver or stomach fire or transformation of exterior pathogens to heat. In combination with suitable points, SI1 may be used in any of these 2 patterns. Finally, in common with the other lingual points, SI1 is used to revive consciousness and is indicated for loss of consciousness from wind stroke. As the entry point on the small intestine, little marsh revitalized the meridian. A marsh is a fertile wetland, a humid place where water collects, much like a well. As the metal point on small intestine, little marsh carries a resonance of metal. Its mineralizing, enriched quality of qi and blood, discriminating balance to assist the small intestine in its role of separating the pure from impure and the clear from the cloudy. When the small intestine loses its quality of discrimination, inappropriate behavior and maturity can influence behavior, replacing the purity, propriety, and joy in life appropriate to the fire element. The alternative name, small propitiousness, highlights the role of small intestine. Propriety is the virtue of the heart. The small intestine, the separator of pure from impure, where enhances by its resonance of metal, informs us of the importance of the ability to discern what is appropriate and correct, to discriminate in our consciousness. There is a filtering of all levels of body, mind, and spirit so that we can focus on with clarity, without cynicism, and with our body appropriately discarding what is impure. In order to appreciate, be inspired, be vital in our consciousness, the small intestine's role in assisting the purifying aspect of fire must function well. As the purifu to the supreme controller, it is a crucial role. When imbalance in the small intestine means our system becomes polluted, relating appropriately to others, touch, humor, sting in the tail, comments can become difficult, and loneliness, lack of joy, and a lack of confidence can result. This point can affect a rapid change of sensibility, as most lingual points do. As its most distal point, SI1 has a dynamic effect on the opposite end of the meridian and dens the mind. This point can help clear mental model and increase the ability to assess and absorb ideas. The heart, the yin partner of the small intestine, opens into the tongue and affects speech. The speech needs to be clear and able to convey the intended meaning, the truth of the heart. Lingual points affect fullness below the heart. SI1 crosses with REN17 and so also connects with this area in this way. Xiao reminds us that this is the first point after Han Shu Yin, the heart meridian, the paired official with small intestine. As the arm branch of the Tai-Yang, bladder, and small intestine, the small intestine pathway is the most superficial, and its symptomatology is mostly to do with the exterior and local problems. It is relatively rarely mentioned in point combination patterns for intestinal problems. As lingual points, SI1 can help expel pathogenic factors, particularly from the opposite end of the meridian, that is the head and neck. The small intestine pathways connects with Dumai, links with GB1, affecting the eye, passes around the ear, and the lateral aspect of the nose, and can be used for tonsillitis, mouth ulcers, fever, chills, headache. It opens the orifices and promotes resuscitation in cases of internal wind and phlegm, blocking the orifices, causing sudden unconsciousness, convulsion due to heat, chest and intercostal pain, and tongue stiffness. SI1 can be used for ear problems, example yung tinnitus, given the pathway of small intestine travels to and through the ear and the use of lingual points to expel pathogens. The vigorous nature of qi at this point removes the obstruction from the channel. SI1 can be used for pain in the little finger and as a distal point for channel problems of the neck, such as chronic stiff neck or acute torticollis. Empirical point to promote lactation after childbirth when there is stagnation or a pathogenic factor inhibiting the flow and for problems affecting the breast. Thank you for your attention.
Let's discuss liver 3, great rushing, or TAICHONG, a source Yuan point. Location on the dorsum of the foot between the first and second metatarsal bones in the depression proximal to the metatarsophalangeal joints and the proximal angle between the two bones. How to find liver 3? From the web between the first and second toes, palpate proximally past the metatarsophalangeal joints and along the groove between the first and second metatarsal bones until you reach the widest and deepest part of the groove. There, locate liver 3, which is often sensitive to pressure. To double-check, when continuing to palpate along the groove, it will become more narrow and shallow again. Located in a similar position on the hand is LI4, between the first and second metacarpal bones. Needling vertically or slightly obliquely, 0.5 to 1 zoom. Caution during pregnancy. Actions, indications of liver 3, spreads liver qi, clears the head, benefits the eyes, nourishes liver blood and liver yin, calms spasms, alleviates pain, regulates menstruation and the lower burner, eliminates internal wind, pacifies liver yang. Special features, Yuan-source point, shoestring point, earth point, Madanyang heavenly star point, later added by Shu Feng, a major point for spreading liver qi. Liver 3 is a major point. It is an extremely important point of the liver channel, used mostly to drain the liver in excess patterns, although it can also be used with reinforcing method to nourish liver blood. Liver 3's main action is that of subduing liver yang, and it is very frequently used in migraine headaches from liver yang rising. It is somewhat gentler than liver 2. It also extinguishes interior wind, and it has a specific action in calming spasms, contraction, and cramps of the muscles. Combined with LI4, it expels wind from the face and is used for facial paralysis and tic. This combination is called the four gates, and it also calms the mind, regulates ascending and descending of qi, and subdues rebellious qi. Liver 3 has a profound calming effect on the mind and is effective in calming very tense people who are prone to short temper or experience feelings of deep frustration and repressed anger. However, its calming action is not limited to its action on feelings of anger, which are typical of a liver disharmony, as it is also effective in general irritability and tendency to worry from emotional stress. Its calming action is enhanced when combined with LI4. The four gates. Liver 3 is a very important gynecological point, as it activates the penetrating vessel or chongmai. The name of this point is related to the penetrating vessel, as the character chung in this point's name is the same as in chongmai. In fact, when the first chapter of the Simple Questions refers to the penetrating vessel being flourishing at 14 in girls and 16 in boys, it calls this vessel not the chongmai, but the taichung vessel, that is the liver 3 vessel. Therefore, whenever we use liver 3, we activate the penetrating vessel and we invigorate blood in the uterus. For this reason, liver 3 is a major point for blood stasis and painful periods. This effect is due also to its spasm calming effect. Liver 3 calms spasms, resolves contraction, and stops pain. Liver 3 resolves dampness primarily from the genitourinary system, but also from the liver and gallbladder, as the indication jaundice shows. In this context, it is used for hernial and genitourinary disorders, or the Shan disorder, in a similar way to liver 1. Needled with reducing method and followed by moxibustion, It can expel cold from the liver channel and treat genital swelling and orchitis in men, or chronic white vaginal discharge in women. To summarize, liver 3 subdues liver yang, so it's good for headache, dizziness, blurred vision, numbness of the head. Extinguishes interior wind, as in opisthotonus, epilepsy, deviation of eye and mouth, promotes the smooth flow of liver qi. In hypochondrial distension, irritability, epigastric and abdominal distension, sighing, breast distension, nausea, constipation, borborygmi. It resolves dampness, so it's good for hypogastric fullness, hernial and genitourinary disorders, the SHAN, swollen testicles, pain in genitalia, retracted testicles, swollen vulva, difficult urination, retention of urine, and jaundice. Invigorates blood and regulates menstruation. So good for amenorrhea, irregular periods, painful periods, excessive menstrual bleeding, prolapse of uterus. Calms the mind for those with propensity to outbursts of anger, irritability, insomnia, worrying. Calms spasms like cramps, stiffness of the lower back with inability to bend, contracture of sinews. So let's compare liver 2 and liver 3. Liver 2 is specific to drain liver fire. It has now no strong mental effect, and it is used only to drain. Liver 3 is not so much for liver fire, more to subdue liver yang. It has a strong mental calming effect. It can be used to nourish liver blood. Liver 2 has no specific effect on spasms. It is quite a harsh point, mostly to subdue rebellious qi. Area affected is mostly head, secondarily genitals. Liver 3 has a specific effect on spasms, a gentler point to subdue rebellious qi, but also to promote the smooth flow of qi when it stagnates horizontally, for example, in epigastrium or hypochondrium. Areas affected are head, epigastrium, hypochondrium, and abdomen. Thank you for listening.
Let's now talk about gallbladder 37, or the bright light, Lu connecting point. Gallbladder 37 is 5-tuned proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula between the peroneus longus and extensor digitorum longus muscles. How to find gallbladder 37? Using the quick method with spreading hands technique. We place the little fingers on GB34, which is in the depression anterior and inferior to the head of the fibula, and on the highest prominence of the lateral malleolus. This distance is 14 chun. From the midpoint of this distance, measure 2 chun in a distal direction and locate gallbladder 37 on this level in a depression on the anterior border of the fibula. This depression is located 5 chun proximal to the prominence of the lateral malleolus, which is equivalent to the width of 1 hand and 2 thumbs. For orientation, the border of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the anterior border of the fibula just superior to the ankle and then locate the point on an imaginary line running to the head of the fibula. GB37 is needled vertically 0.5 to 1.5 chun. For its actions and indications, it benefits the eyes, it eliminates wind damp, opens the channels, and alleviates pain. Its special feature, it's the Lu connecting point, and it's also an important distal point for disorders of the eyes. The most important function of GB37 is that of benefiting the eyes, improving eyesight, and eliminating floaters in the eyes. It is particularly effective for eye problems due to liver fire as it conducts fire downwards. So GB37 brightens the eyes. That's why it's good for eye pain, diminished night vision, itching of the eyes, myopia, and blurred vision. It also conducts the fire downwards, So it can treat red, swollen, and painful eyes, headache, and bitter taste. The Guide to the Classics of Acupuncture states, the Lu connecting points are located between two channels. If they are punctured, symptoms of the exteriorly related channels can be treated. The liver opens into the eyes, and the liver, gallbladder, and the gallbladder divergent channels connect with the eye. Many of eye diseases derive from liver pathology, and as its name, bright light, suggests, GB37, the Lu connecting point of the gallbladder channel, is the principal distal point of the channel for the treatment of a wide range of eye disorders, including pain, redness, itching, long and short-sightedness, and night blindness. Its second function of activating the channel and alleviating pain is important in two ways. Firstly, by dispelling wind damp and regulating the circulation of qi in the lower limb, it is effective in treating a wide range of disorders of the lower leg, including knee pain, pain of the lower legs with inability to stand for long, atrophy disorders, and painful obstruction of lower limb with numbness and heat, and pain of the lower leg. Secondly, the gallbladder primary channel passes through the chest, whilst its sinew channel links with the breast, and gallbladder 37 is indicated for distension and pain of the breast due to stagnation of liver qi. Finally, the Great Compendium of Acupuncture and Moxibustion gives specific indications for excess and deficiency of the Lu connecting points. In the case of gallbladder 37, these are heat sensation of the lower leg, knee pain, numbness of the body, and propensity to grind teeth in excess, and atrophy disorders of the leg with difficulty in standing after sitting in deficiency. The gallbladder is an extraordinary fu. It works only with what is pure and clear and stores and excretes refined essence and qi. If gallbladder is imbalanced, distortion can appear at all levels of the body, mind, and spirit. Contorted decisions and plans, confusion, poisoned imagination, and perceptions will further injure the gallbladder. Use this point to bring balance, correct and clear-sighted decisions, and upright judgment making to purify the perspective, to reestablish benevolence and mean radiance of the spirit, and to restore the free flow of gallbladder and liver qi in the negotiation and continuity of life. This clear yang aspect of the gallbladder not only lightens the spirit, but restores a deep vitality within us. It is a major point for eye disorders, not just a distal gallbladder point, but as the Lu connecting point with its elemental pairing, the liver, which opens into the eyes. This point is said to restore light to the eyes, improving eyesight and eliminating floaters. This harmonizing effect of this point makes it useful for unilateral headaches and tension of the jaw. Gallbladder 37 conducts fire downwards and is used when liver fire is harassing the eyes or when a person is easily irascible and angry. Good when medication has overtaxed the liver and gallbladder. The activating effect of this point, and it being the Lu connecting point with the liver meridian, gives it a far-reaching effects, making it helpful for tension, pain, numbness, and weakness of legs, and to regulate the circulation of qi in the leg. The gallbladder meridian also passes through the thorax, and this point is beneficial when there is tenderness and distension of the breast and possible emotional lability that can arise with premenstrual tension, usually from liver qi stagnation. So to summarize its function, gallbladder 37 regulates and tonifies gallbladder and liver, activates the meridian, eliminates wind, clears heat, conducts fire downwards, transforms damp heat, and opens and brightens the eyes. Thank you for your attention.
We go to the bladder 17, the back transporting points, diaphragm shoe. Location, bladder 17 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 7th thoracic vertebra, T7. How to find the spinous process of T7 is approximately on the level of the inferior angle of the scapula. Bladder 17 is located on the level of the lower border of its spinous process and 1.5 June lateral to the midline at the highest point of the paraspinal musculature. Or use the spinous process of T3 for reference, generally on the level of the medial end of the scapular spine. Or use C7 as a reference point. Located on the same level are DO9 on the midline, a point of EXB2, 0.5 June lateral to the midline, and bladder 46, 3 June lateral to the midline. Bladder 17, needling, 0.5 to 1 June obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needle retention. The needles can be secured with tape. Caution, pneumothorax. For the action indication, bladder 17 cools blood heat, stops bleeding, removes blood stasis, nourishes and harmonizes the blood and yin. It also regulates the diaphragm, descends counterflow qi, moves qi locally and along the channel pathway. For the special features, bladder 17 is the back shoe point of the diaphragm, with meeting point of the blood. Bladder 17 is an important point with many functions. First of all, it has a multifaceted effect on blood as it can invigorate, cool, and nourish blood and stop bleeding. Its primary function is to invigorate blood and stop bleeding. An interesting passage in the explanation of acupuncture points correlates the multiple function of this point in relation to blood to its location in between bladder 15 and bladder 18, bladder 17, bladder 15, bladder 18. The heart generates blood and the liver stores blood, hence this point affects blood. Firstly, bladder 17 invigorates blood, that is, removes stasis of blood from any organ, but only if needled, no moxa, with either reducing or even method. It is used as a general point to remove stasis of blood in any organ and from any part of the body, but especially the upper part. It can be combined with the back transporting points to eliminate stasis of blood of the relevant organs. For example, combined with bladder 18, it removes stasis of liver blood, while combined with bladder 15, it removes stasis of heart blood. As bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. Clinical note, as bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. Secondly, bladder 17 cools blood and stops bleeding, but primarily bleeding upwards. That is coughing of blood, vomiting of blood, and epistaxis. This action in stopping bleeding upward is also connected to its action in subduing rebellious qi, a pathology that is often present in bleeding upward. Thirdly, although the ancient texts seldom stress this function, bladder 17 can nourish blood if used with direct moxibustion. It is therefore used for deficiency of blood of any organ. It is usually combined with the back transporting points to nourish the blood of the relevant organs. For example, it is combined with bladder 18 to nourish liver blood, with bladder 15 to nourish heart blood, and with bladder 20 to promote the spleen function of producing blood. Fourthly, bladder 17 moves qi in the diaphragm and chest and is used for feeling of oppression and pain of the chest and fullness in the epigastrium. Fifthly, bladder 17 pacifies stomach chi and it subdues rebellious stomach chi, which is stomach chi going upward instead of downward. It therefore treats such symptoms as hiccup, belching, nausea, and vomiting. Sixthly, bladder 17 has a general tonification effect on all chi and blood of the whole body, if used with direct moxibustion. To this effect, it is usually combined with bladder 19, and the combination of these 2 points is called the 4 flowers. Another combination to tonify chi and blood in general is with bladder 18 and bladder 20 with direct moxibustion. This combination is called the Magnificent Six, counting each point bilaterally. For the summary, it invigorates blood with those having heart pain, stabbing chest pain, pulls blood, stops bleeding, those coughing with blood, vomiting of blood, and nosebleed, and it nourishes blood with using direct moxa. Opens the chest and diaphragm, subdues rebellious chi, those having epigastric pain, vomiting, hiccup, difficult digestion, sour regurgitation. It also benefits the sinews, those having painful obstruction syndrome, B syndrome of the whole body, pain in the whole body, swelling, distension, and pain of the body. It also tonifies chi and blood with bladder 9, used with bladder 19. Thank you for your attention.
Now let's discuss the points of the lung primary channel. Specific points according to function. So the Yuan-source point is lung 9. Luo connecting point is lung 7. Shi cleft point is lung 6. Pertaining backshoe point is bladder 13. Pertaining front mu point is lung 1. The 5 shoe transporting points, the Jingwell point, the wood, is lung 11. Ying spring point, fire, lung 10. Shoe stream point, the earth tonification point is lung 9. Jing river point, metal, the pen point, lung 8. The Husi point, water, sedation point is lung 5. Influential or Hui meeting point of the vessels is lung 9. The opening point of the Renmai is lung 7. Chao Hui meeting points with the spleen primary channel is lung 1. Of other channels with the lung channel, we have the Kawu command point for the occiput and nape is lung 7. Window of heaven point is lung 3. Madanyang heavenly star points, lung 7. Sun Si Miao ghost point is lung 11. Points according to region. Local points, for the lung, we have lung 1. For the elbow, we have lung 5. For the wrist, we have lung 7. Adjacent points, the hands, we have lung 7. Distal points, the occiput, we have lung 7. Throat, lung 10. Lung 11. For the lung, lung 5. Lung 7. And for the shoulder, lung 7. Specific points according to the course of the channel in numeric order. Lung 1. The associated front mu point is the Jiao Hui meeting point with the spleen channel. Lung 3 is the window of heaven point. Lung 5, Husi point, sedation point, distal point of the lung. Lung 6 is the Shi cleft point. Lung 7, Luo connecting point, the opening point of the Renmai. Also the Gao command point of the nape and occiput. Madanyang heavenly star point, distal point for the occiput, shoulder, and lungs. And adjacent point for the hands. Lung 8, Jing River point, metal is the bend point for the five-face point. Lung 9, Yuan-source point, Hui meeting point of the vessels, shoestring point. Earth, tonification point. Lung 10, Ying spring point, the fire, distal point for the neck. Lung 11, Sun Si Miao ghost point. Jingwell point, wood, is the distal point for the neck. So here we have the target areas for the lung channel. So I would suggest that you just take a screenshot of this whole thing because it already tells a lot about what we have discussed. Thank you very much for your attention.
We now discuss about location methods and tune measurements. One of the basic prerequisites for any successful acupuncture treatment, besides a differential Chinese medicine diagnosis and the relevant point selection, is the correct point location. There are various methods for locating acupuncture points. So first we have here the anatomical approach. Many acupuncture points are situated at the clearly defined anatomical locations. For example, in depressions, at muscles and tendon insertions, in grooves, at joint clefts, at bony prominences, etc. With some experience, the palpating finger will often automatically fall into the right depression and holes. Various anatomical structures and zones form the basis for point location. Second approach is using the fixed markers. Fixed markers are not affected by body position or by movement. These include bony landmarks such as depressions or prominences of the skeletal system, but also the finger and toenails, the nipples, the umbilicus, etc. Most of the proportional tune measurements rely on fixed markers. Third approach, using the movable markers. Movable markers often become more clearly defined with a particular body posture or movement. For example, by flexing the elbow, the cubital crease becomes much more clearly visible to locate LI11 precisely. Equally, the most distal palmar crease becomes much more visible when making a loose fist in order to locate SI3. One other parameter that might determine the location of a point include change skin consistency, sensitivity to pressure, puffiness, or a resistant sensation when palpating gently with a finger. Fourth method or fourth approach, using proportional measurements. When trying to locate points not situated at any prominent structure, Chinese medicine applies the proportional tune measurements. Fifth approach, using electric tools. These measure the electric resistance of the skin in order to find the correct location of the points. Generally, electric resistance is lower in the immediate area around the point. This method is specially used in auricular acupuncture, but it has not proved to be a practical method for body acupuncture. The sixth approach, using the very point technique as described by Dr. Gleditsch in 2005. The needle is held loosely and guided in a dancing fashion over the skin. When the correct point, the very point, is found, the needle will catch onto it and penetrate the skin as if out of its own volition. Now let's talk about tune measurements of the body. In Chinese medicine, the distances on the body are traditionally measured in tune. In contrast to the official Chinese tune, which is 1 tune equal to 2.5 centimeters, the tune used in medical context is a proportional unit of measurement that takes the individual proportion of each body into account. This relative unit of measurement is defined by either using the width of a particular finger or fingers, which is the finger tune, or by the distances between clearly defined landmarks of the body, or the body tune. In clinical practice, many points can be located by using finger tune measurements. It is important, however, to use the patient's fingers, not the practitioner's fingers, for reference. If the fingers of both the practitioner and the patient have approximately the same width, the width of the practitioner's fingers can be applied for point location. Otherwise, measurements have to be adapted to correct minor deviations, for example, by adjusting the spaces if it's narrow or wide, between the practitioner's fingers when using finger tune measurement. Here we have a table on how to use the finger tune measurement. So 1 tune as thumb measure. It is the width of the interphalangeal joint of the thumb as its widest point. 2 tune as index finger measure. This is the distance of the 2 distal phalanges of the index finger. 1 tune as middle finger measure. With the tip of the middle finger placed on the thumb, the distance between the ends of the creases of the interphalangeal joints of the middle finger. 1.5 tune as 2-finger measure. This is the width of the index finger and the middle finger when placed closely together at the level of the distal interphalangeal joints. With 2 tune as index, middle, and ring finger measure. This is the width of the index, middle, and ring finger when placed closely together at the level of the distal interphalangeal joints. 3 tune as 4-finger measure. This is the width of the 4 fingers when placed closely together at the level of the distal interphalangeal joints. This is also equivalent to the 1-hand breadth. Second approach is the body or proportional tune, which is based on the proportions of particular sections of the body, which are divided into a specific number of units. In clinical practice, the measure of these divisions can be quite cumbersome. Therefore, the spreading hands technique is commonly applied. It allows the practitioner to quickly determine the midpoint of a given distance, and combined with finger tune measurement and palpation, is in most cases sufficient for correctly locating a point. For point location on the abdomen, a prepared elastic tape can be used for measuring proportional tune. Thank you very much for your attention.
Now we go to the 4 Cs, REN17 chest center. Location, REN17 on the anterior midline on the level of the 4th intercostal space. How to find? The quick method, especially in men, locate REN17 on the sternum between the 2 nipples. For more detailed orientation on the intercostal region, first locate the manubriosternal synchrodrosis, which can be felt on the sternum as a well-defined horizontal bony structure on the level of the costal cartilage of the second rib. The second intercostal space is below it. From there, count in an inferior direction to the 4th intercostal space. Locate REN17 on this level on the midline of the sternum. Located on the same level in the 4th intercostal space are kidney 23, stomach 17, PC1, spleen 18, GB22, GB23. 2 tune lateral to the midline on the nipple, 1 tune lateral to the nipple, 6 tune lateral to the midline on the axillary line, 1 tune anterior to GB22. Needling, depending on the indication, 0.5 to 1 tune transversely, subcutaneously in the superior or inferior direction or towards the nipples for mammillary disorder. Caution, intracardiac needling, pneumothorax. The sternum can be very thin in this area owing to embryonic ossification disorders. Moxibustion is recommended in order to tonify the chi, but caution with asthmatic patients. For the actions and indication, REN17 regulates and benefits the chi, unbinds the chest, descends counterflow, lung, and stomach chi. It also benefits the breast. For the special features, REN17 is the front move point of the pericardium, meeting point with the spleen, kidney, small intestine, and triple burner channels. Meeting point of the chi, C of chi, important point for respiratory disorders. Central altar is the residence of the shen and the heart. The Ling Shu calls this area of the body the place of the heart governor. the palace of the heart governor, a protected place, partly through the energetic geography of being within the breast, which enables appropriate dissemination of the intent of the supreme controller, both within the realm of the body, mind, and spirit, and in communication with others. The TAICHONG connects directly with the heart and lungs, an influential gathering point of the qi and a point of sea of qi. It enlivens and tonifies the heart and lungs and promotes good circulation of qi. When the person is exhausted and feels their reserves have run out and they can no longer connect with the heavens, REN17 can nourish the heart and balance the qi. Labored breathing or cough when there is stagnation of lung qi, or a failure by the lung to descend the qi, or oppression from stagnation of heart or lung qi can be influenced here. When REN17 being a point to promote the circulation of qi and blood, the multiple crossing and connection with various officials, it is a powerful point. Here, the heart receives the spirits and influx of heaven, and directing of our life can unfold from here as the officials carry out the communication of the heart. This point assists the truth of the heart to be conveyed and the authentic development of the person to arise. It can restore the radiance and power of the Shen. Along with dovetail REN15, TAICHONG is the front move point of the heart protector and also for the upper jaw. The importance of protecting the heart so it can fulfill its role as a supreme controller. Undisturbed is primary among the roles of the heart protector. Front move point becomes spontaneously tender when their associated organ is in balance. Because of this spontaneous reaction, some consider them mostly for acute situations, but mu means to collect, raise, enlist, and the qi of the associated sangfu collects and concentrates at these points. Front mu points are yin in nature and can be used in non-acute situations to nourish and strengthen the particular sangfu, but without a direct effect on the particular meridian. As a C of qi point, along with stomach 9, bladder 10, or sometimes do 15, do 14, REN17 can be used to regulate qi. The text says that if this C is replete, there may be fullness in the chest or abdomen, congestion, and a florid complexion. If deficient, there will be weakness and loss of voice. This combination is only called upon in chronic situations when the deep regulation and reserves that the C can offer is necessary. It tonifies the qi of the chest. REN17 regulates the upper jaw, and the lung qi diffuses and descends lung qi. Disperses stagnation of qi in the chest or the heart and lungs, redirect rebellious qi downwards, expands and relaxes the chest, warms yang, clears phlegm. Thank you for your attention.
Let's now discuss the 4 levels still on common cold and influenza. The symptomatology of wind heat was elaborated in detail by the School of Warm Diseases. In particular, Yuan-source formulated the theory of the 4 levels to describe the symptomatology of invasions of wind heat. The 4 levels are as follows. Under the defensive qi level, we have wind heat, damp heat, summer heat, wind dry heat. Qi level, under this, we have lung heat, stomach and intestines dry heat, gallbladder heat, stomach and spleen damp heat. The 3rd level is the nutritive qi level. So we have heat in the pericardium, heat in nutritive qi. And finally, the blood level. Heat victorious agitates blood, heat victorious stirs wind, empty wind agitates in the interior, collapse of yin, collapse of yang. The 1st level concerns the exterior stage of an invasion of wind heat. The other three levels describe pathological conditions that arise when the pathogenic factor penetrates the interior and turns into heat. The four levels represent different levels of energetic depth, the first being the exterior and the other three being the interior. The interesting part of this theory is the distinction within the interior of three different levels, the chi level being the most superficial, this is within the interior, and the blood level the deepest. The defensive chi level of the four levels broadly corresponds to the greater yang stage of the 6 stages. The defensive chi level deals with wind heat and the latter with wind cold. Although the clinical manifestations are different, they share common features as they are both characterized by invasion of an exterior pathogenic factor, the impairment of the lungs diffusing and descending of qi, and the obstruction of defensive qi in the space between the skin and muscles. For this reason, we refer to both the greater yang stage of the 6 stages as the defensive chi level of and the defensive chi level of the 4 levels as defensive chi level. The main symptoms of invasion of wind heat are aversion to cold, shivering, fever, sore throat, swollen tonsils, headache and body aches, sneezing, cough, runny nose with yellow discharge, slightly dark urine, slightly red sides of the tongue, and a floating red pulse. It is worth noting that in wind heat, too, there is aversion to cold, as this is due to wind heat obstructing the defensive chi, which therefore fails to warm the muscles. Thus, common cold and influenza will always start with manifestations similar to the greater yang stage of the 6 stages or the defensive chi level of the 4 levels, depending on whether the pathogenic factor is wind cold or wind heat. If the pathogenic factor is not expelled at the beginning stages, it will change into heat and penetrate into the interior. Thank you so much for listening.